Hey guys, so welcome to my very first episode of Medical Mysteries, Mayhem and Makeup. Thank you so much for joining me today. I'm glad you all are here and excited to learn about issues in the field of healthcare, health and medicine from both the past and present day. I thought I'd start off with a current issue to bring awareness to anyone that may work in the healthcare field or have a loved one in a healthcare center. So while I talk, I'm going to go ahead and do my makeup, and I'm just going to briefly show you what products I'll be using while I'm talking. I've already prepped my skin and with all my skincare products, and then I'm gonna go ahead and prime it using my iconic Underglow blurring primer. And then today I'm gonna go ahead and use my Urban Decay Stay Naked Hydromaniac Tinted Glow Hydrator. Has a mouthful, but this isn't fair because I'm very pale. So it's something light enough to, you know, match my neck here. I do have some redness, so I'm going to use that today. And then I'm going to go in with the new LYS concealer that I've been trying out. This is what it looks like. It's got like a little felt tip there, and then you have to like click it a lot to get any product to come out. So I'm still playing around with it. The verdict's still out. I don't know if it's my favorite. I don't know. I like it so far, and I really enjoy LYS. I absolutely love their translucent setting powder, so I'm gonna set with that. I've hit pan on this. I can't tell you how many times I have reordered this product. And then I'll go in with my Hoola bronzer. I have this Colourpop blush called Chaise, so I'll probably use that today. I don't know. That might be a bit light. We'll see. We'll play around with it. And then I'm going to use the Colourpop highlighter called Buckbeak from the Harry Potter collection. And then I'll do my brows. I'm using my NYX Professional Makeup Micro Brow Pencil. And then I have my iconic London Tint and Texture Brow Perfecting Gel. So for my eyes, I'm going to go ahead and use this palette of single shadows that I have. I'm pretty sure most of these are from Shop Miss A AOA Studio. And then I have another one that is a bunch of shimmers. It's a mixture. Some of them I think might be from Shop Miss A. There's a whole bunch of them in here. And then there's a brand that was called Looxie Beauty. They were awful. They went out of business and stole a bunch of people's money. It was terrible. So I'm not promoting that company. It's just I wanted to use some colors in here because I wanted to go ahead and do a fall look while I go ahead and chat with you guys. So that's it for everything I'm going to use. Anything else I use on my eyes, I think I'll just list it all below because I don't know what eyeliner I'm going to use. I don't know what lashes, so I'm not going to go ahead and give you that detail right now because I don't know what I'm going to use until we get to that point. So I think I'm just going to pin my hair back like so, get that out of my face, and then I guess if you're ready, let's get into it. So for those of you that don't know, I work in the healthcare field, and I'm coming up on almost 20 years. 20 years. And I have worked in every setting from acute care to home health. I've pretty much been in it all. Hospitals, rehab centers, home care, like I said. But primarily now I work in skilled nursing, short-term rehab, and long-term care. So a topic that has been weighing on me is a topic concerning bed rails and bed sores, also known as pressure ulcers. I feel the two topics are directly correlated, so I thought I would sit and discuss these things with you, because it is a problem. It is a very large problem. So just to kind of start things, you know, because some of you might not be in the healthcare industry and you might not know. So I'm going to go ahead and just kind of go over some facts. So there are approximately 15,600 nursing homes in the United States. That is crazy. Like, that is a lot of nursing homes. And that data is from the CDC and the senior list. And then they go on to say that there are over 1.7 million licensed beds and care is provided to approximately 1.4 million people. That is a lot of people. That is a lot of beds that are in hospitals, long-term care, short-term care, you know, across the board. But ultimately, there's 15,600 nursing homes in the United States. And you got to think a lot of nursing homes have, you know, double beds per room. Most facilities are certified to provide both skilled nursing care for short-term recovery, like after a fall, or someone gets pneumonia and is sick and, you know, has received treatment, or if you've had a stroke or a major joint replacement, for instance. You know, it's just to name a few things. That's not all encompassing. So anybody with those types of diagnoses can go into these types of facilities. And then they also provide care to long-term residents with ongoing health conditions and who are unable to live in, let's say, like assisted living facilities, or being able to go home independently on their own. Now, in these facilities in recent years, they are saying bed rails are restraints. Okay, so just imagine you're in a nursing home, you're not feeling good, and you're in this little small twin bed. Let's say you're used to having like a double size bed at home, or, you know, even a queen size, king size bed, and now you're put in this tiny twin bed and there's no bed rails, right? So they've taken the rails off of the beds, which is crazy because they're still on beds in hospitals, right? So you have these people coming in, like I said, and then they're putting them in these small beds. They're sick, they don't feel good, you know, what have you. So let's go ahead and take the rails off and put you in a very narrow environment, okay? They're saying that since someone got injured from entanglement in the actual bed rail, that it is dangerous to have them on the beds, and that the patient resident has a right to fall. So now somewhere along the line in healthcare, we're saying, oh, you know what? Let's not keep these people safe. Let's go ahead and let's say they have the right to fall. They have the right to fall out of bed, hit their head, have a subdural hematoma, and die, right? Because that's what I'm thinking. We're talking older people, frail people, sick people, you know, what have you. That's just to name a few of the things. But it's like, really, they have a right to fall. Very interesting to me. So I was digging around and I found a statistic from the FDA that says between 1985 and 2009, so that's a 24-year period, 803 incidents of patients caught trapped, entangled, or strangled in beds with rails were reported. Of those reports, 480 people died. So over 24 years, 480 people died. 138 had non-fatal injuries, and 185 were not injured because staff intervened. But what gets me is, according to the Joint Commission, bed rails, aka side rails, would be considered a restraint if they are preventing a patient from voluntarily getting out of bed or attempting to exit the bed, as this restricts freedom of movement. Okay, so they're saying, yep, it's a restraint if you're using the bed rail to keep somebody from getting out of bed. Okay, that I could see. Like, yep, don't put the bed rail on if you're putting it there to keep that person in bed. Okay, but thing is, a half of a rail on a bed isn't a restraint, because the Joint Commission then goes further to say the number of rails used is also a factor. For example, if there are 4 bed rails, which I don't know where you get 4 bed rails from, because if you have a headboard, and a footboard, then those would be 2 really long bed rails. So maybe they're talking like half a rail to make 1 rail. You know what I mean? So they're saying if there are 4 bed rails and all 4 are raised, then yes, that's a restraint. So think about, you know, putting somebody in a bed and having something all the way around it so they can't get out. They would have to climb over it. Yes, that is hazardous. That is you restraining them and trying to keep them in the bed, kind of like you would with a toddler, right? Like you put up those safety rails on the side so toddlers can't roll out of their bed and they can't get hurt, right? Kind of the same concept, or just to give you like a visual. However, raising fewer than 4 side rails would not necessarily immobilize or reduce the patient's ability to move freely. And again, this is the Joint Commission reporting that. They're saying, hey, all 4, patient can't move. Yeah, that's a restraint. But putting just a half of a one up, that's not a restraint. So with that being said, we can then assume if the bed had 2 half rails and only 1 half rail was up at a time, or even both were up, it would not restrict a patient, correct? Because they'd still be able to exit the part of the bed that had no rail. Okay, so you can't just say, oh, giving these people a bed rail is a restraint, because it's not. It would have to be on all 4 sides of the bed, preventing them from moving freely. Okay, so now that we all have that understanding, right, let's talk bed sores. So according to the Mayo Clinic, bed sores, also known as pressure ulcers, pressure injuries, and decubitus ulcers, are injuries to the skin and the tissue below the skin due to pressure on the skin for a long time. These sores often arise on skin that covers bony areas of the body, such as the heels, the ankles, the hips, and the tailbone. Now, when are you getting pressure on your heels and your tailbone? When you're laying on your back for prolonged periods of time, or on your ankles and hips when you're put on your side for a prolonged period of time. So then the Mayo Clinic proceeds to say the people who are most at risk of bed sores have medical conditions that keep them from changing positions or moving, or they spend most of their time in a bed or a chair. And these sores can arise over hours or days. So it doesn't take a long time to start developing these bed sores. Or these pressure sores or pressure ulcers. I don't want to just call them bed sores, but I'm mainly focusing on bed sores, not so much people that are in wheelchairs and more mobile and moving around. Now, to have an understanding of that, you need to realize that there are 4 main stages of pressure ulcers. So the first stage is non-blanchable redness on intact skin over a bony prominence. So again, thinking about those areas of like your hips, your ankles, your heels, or where your tailbone is, the area over that bony prominence will become red. Okay, so it's not broken down or anything like that. You'll just start to notice like redness in that area. Stage 2, a partial thickness skin loss involving damage to the epidermis and dermis layers of the skin. So that's that first layer and then that underneath layer you're looking at. Stage 3 is full thickness skin loss, extends to the subcutaneous tissue but doesn't cross the fascia beneath it. Slough and eschar may be visible and the lesion may be foul smelling. Okay, so you're getting a little further down underneath through those first 2 layers of the skin. Stage 4, you have full thickness tissue loss that can expose bone, muscle, or tendons. Now, just thinking about that, I don't know about you, but if I was stuck in a bed and I had a stage 3 or even a stage 4 pressure ulcer, that's going to be pretty dang painful. I mean, especially if you think about a stage 4, you've gone through all the tissue covering the muscle and the tendons. And now all of that is exposed. So you've gone through all those layers, and within your layers of skin, you have all those nerve endings. So could you imagine the amount of pain that these people feel? So now that you understand that, you realize that there's 4 stages. You know, obviously stage 4 is the worst. That's like things are exposed that should not be exposed. Let's talk about a couple of statistics, okay? According to the Agency on Healthcare Research and Quality, more than 2.5 million people in the United States develop pressure ulcers. Now again, that's 2.5 million people. So that's not just, you know, people in long-term care, you know, settings or things, you know, of that nature. Just a very generalized statistic that 2.5 million people just in the United States develop pressure ulcers. And they say that these skin lesions bring pain, associated risk for serious infection, and wait for it, increased healthcare utilization. So pressure ulcers are associated with longer hospital stays and increased morbidity and even mortality. They also remain a serious problem in nursing homes despite regulatory and market approaches to encourage prevention and treatment. Let me go ahead and say it again for the people in the back. Pressure ulcers are associated with longer hospital stays, increased morbidity, and mortality. They also remain a serious problem in nursing homes despite regulatory and market approaches to encourage prevention and treatment. So now, according to the Agency for Healthcare Research and Quality, bed sores cause over 60,000 deaths each year. 60,000. So remember that report I talked about earlier, that due to bed rails, that in a span of 24 years, 480 people died over a 24-year period, but 60,000 people die per year due to bed sores? That's insane. That is absolutely insane. But what's crazy is they're saying that bed sores remain a serious problem in nursing homes despite regulatory and market approaches to encourage prevention and treatment, right? So why are 60,000 people dying each year related to bed sores? Another statistic says it is estimated that since 2009, studies have shown prevalence rates of pressure ulcers to be anywhere from 7% to 23% among nursing home residents. But according to an article published by the National Library of Medicine via the National Institute of Health, the U.S. government relies on nursing home reported data to create quality of care measures and star ratings for Nursing Home Compare, the NHC. And they concluded that pressure ulcers were substantially underreported in data used by the NHC to measure patient safety. It says this study also stated pressure ulcers are key markers of patient safety because they can be prevented and managed with vigilant care. So as I was looking around, I just realized there isn't clear data of the percentage of stage 1 versus stage 4 sores, bed sores, pressure ulcers reported, because obviously the data is skewed or lacking, just like they're saying. They're substantially underreported. So these nursing homes aren't reporting them at the rate that they should be, and this is really concerning. You got to think there's 15,000, there's almost 16,000 nursing homes in the United States, and these things are being underreported. This is like a major problem. So if there are approaches to encourage prevention and treatment, How does removing bed rails from the beds in nursing homes facilitate prevention? So remember, people at risk for bed sores are people that spend most of their time in bed or sitting. Again, I'm really trying to focus on the people stuck in bed that can't roll, can't do these things, and now they're being put in a twin size bed without any bed rails and without a way to be able to try to help themselves use their arms to pull themselves over. Again, think about people who've had a stroke or any kind of cardiac issue, or hip replacement, knee replacement, and hip replacements and knee replacements and things like that aren't always elective. Elderly people fall and break their hip and then have to have a hip replacement done in order to obviously repair it because of that traumatic event. And now you're putting them in a bed and they're like, I can't really use my legs. I would try to use my arms to roll myself over, but there's no bed rails. There's nothing for them to pull on. So what do you think is going to happen? So let's go ahead and talk about a couple states and their, regulations with bed rails, what they supposedly say regarding these bed rails. You have Florida, who says that they require a physician order for a half a bed rail and a review by a physician every 6 months. So you got to get the doctor to say, yeah, okay, we'll go ahead and put one on there. And then it can only be a half of a one, which is fine. Half of a one is better than, nothing. And then they have to go ahead and assess them every 6 months. Okay, so in nursing homes, there's usually a doctor that comes in. Now, every place I've been in, the schedule for the doctor is different. It seems like as of late, I'm seeing doctors in more frequently. I have been in facilities where I've never seen a doctor. They only come in like once a week, and that was on Sundays, which is crazy because they were relying on nursing, to report to them and let them know if they needed to come in, but they weren't coming in and doing rounds until Sundays, which is insane, especially when you have a facility that has over 100 beds. You're telling me a doctor's coming in and seeing over 100 people on a Sunday? Really? I don't think so. Minnesota, it says they allow residents a choice for bed rails as long as staff performs full assessments and reviews every 90 days or following a change in condition. So if something happens to that patient and their condition changes in any kind of way, they have to go in and reassess them and make sure that they are appropriate to still have those bed rails. Pennsylvania permits half of a rail in assisted living facilities if residents can raise and lower them independently. And assessment shows safety. So that was just saying in assisted living facilities, which, we're not even talking nursing home at that point. We're just talking, facility where you kind of live on your own in your little apartment, your room, what have you, and then the staff is only coming in to give you medicine and just kind of check on you and make sure that you're safe, that you're not on the floor. But typically in an assisted living facility, you're able to move around, you're able to do a bit for yourself. It's just you can't be alone all the time unsupervised. North Carolina says supposedly that bed rails are considered restraints if they are used to keep a resident from voluntarily getting out of bed. That's all it said. So they're keeping it kind of vague, kind of, really open is what it seems. It doesn't say that they're allowed. They don't clarify like, hey, we can go ahead and put one on as long as, the doctor says so. It just says, hey, they're only considered restraint if you're using it for keeping somebody from getting out of the bed. California supports the least restrictive approach, requiring that all other alternatives be tried and ruled ineffective before restraints are considered. I don't even, like, that doesn't even make any sense. I don't know. It's like they're not even speaking directly about the use of having these bed rails. It seems like they're more talking about having a restraint and being able to use a restraint, which, okay, you have to try all of their methods before putting on a bed rail to restrain the patient. So I kind of feel like that's how that one is explaining itself. I don't know. That's interesting to me. So I guess with that, knowing all of these things, right, as I've talked, you know, as we're going through, like, all these places, these nursing homes are taking these bed rails off and saying, hey, they're a restraint, right? But if patients are unable to move themselves independently and are at an increased risk already for bed sores, then how can facilities refuse to put bed rails on the beds? Again, if we're looking at the fact that 60,000 people potentially die each year due to these bed sores, as opposed to 408 people dying over 400 and, excuse me, as opposed to, yes, excuse me, as I say 408, it was 480 people died from having the bed rails on. But now you're talking 60,000 people are potentially at risk every year of dying because they've developed these bed sores. And then it's not necessarily that they aren't receiving the care to take care of them, but you have to think, if somebody is bedbound, they can't move themselves, the facility's not putting the bed rail on, or they just took them off and they're like, hey, forget it. These people then are at a risk for continued prolonged bed rest. So here they're developing that pressure sore, and then they're still not able to get out of bed, and they're still laying on their back. They're not being repositioned every 2 hours, because let's face it, these places are understaffed, and these, you know, aides and med techs and nurses and whoever are not going into these rooms and repositioning these people every 2 hours. And there have been so many times working in, you know, these facilities that I've encountered people, you know, just over the years. I mean, I've been in the healthcare field for almost 20 years now, and it's just been within, oh goodness, probably since maybe 2017 or 18. So what is that, 18? So within the past 7 years, I've had so many people that I've encountered, and they just say, oh, bed rails are restraints, we can't use them, and you know that this patient has the right to fall. And it's like they heard that tiny, minute amount of information, and they take it and run with it and make it like an end-all be-all, when that is not the case. That's not the case at all. You know, yeah, I mean, I suppose a patient has the right to fall if you have somebody that wanders around, but, you know, when they're put in a facility, you expect them to take care of them and take the preventative measures to keep them from falling and further injuring themselves, you know? Like, they also have the right to be taken care of. So if you have somebody, a patient or a loved one, you know, in one of these facilities, and you know, you realize, whether you're a healthcare worker, an aide, a friend, you know, a family member, you know, and you have somebody that is in bed, and you're like, man, they're not able to get out of the bed themselves, and they start developing these pressure sores, whether it's on their tailbone or their heels or their hips or their ankles. You know, please advocate for them. Get them bed rails. Try to get them some kind of help to be able to facilitate them moving around in the bed, so they can at least reposition themselves. Because again, let's face it, these people aren't being repositioned every 2 hours like they should be. Now, maybe hospital systems, yes, but again, I'm speaking primarily about nursing homes, long-term care. But also, on the other side of the topic, you know, are facilities held accountable for the overutilization of medical care that could have been prevented? You know, like, if bed sores are preventable and treatable, and yet they're not giving the patients what they need, and in most cases maybe some bed rails would keep these people from being bed bound and being stuck in the bed and not being able to roll over and help themselves. You know, stage 3 to 4 pressure ulcers are very difficult to treat and require daily wound care. So what is going on? Like, it makes no sense to me. It makes no sense to me, again, how I can encounter so many people in so many instances or situations, and they're just like, nope, can't have them. You know, they're, you know, it's a restraint. It's, you know, we're not going to do it. That's crazy to me. It's crazy. So I just hope that now that you're informed and you have this information, that you can help be an advocate for somebody that you may know. I mean, maybe you have a friend whose mother or father is in a facility. You know, maybe that's something that may arise in some kind of conversation along the way. Or you might just encounter somebody, again, in your work that you're like, hey, say you're a CNA, say you're a certified nursing assistant and you have to clean somebody up. You know, you're working really hard to, you know, roll this person over into bed to get them cleaned up. Would a bed rail help? If that person could pull themselves over, have you heard about how many patients get rolled out of beds because of CNAs pushing them over, and then the person can't hold on to anything and they fall out of the bed? It's insane. It's absolutely insane. I just don't understand. Like, what does it cost the facility to even put bed rails on the bed? Like, is it really that much? Don't these hospital beds already come with bed rails? And then you're taking them off? Like, where are you even storing them? You know, if we're talking that there's millions of beds, like we talked about in the beginning, that, you know, most of these facilities, it's 2 beds to a room, and you're saying that 100 or a million, some of these beds are licensed beds. Where are you putting all the bed rails that you're taking off? I don't know. It's just crazy to me, and I really hope that bringing awareness to this situation could potentially help you help somebody avoid getting bed sores or breakdown or being pushed out of a bed or falling or any of the sort. I don't know. My main goal is to just educate and bring awareness, and I hope I accomplish that today. I just hope that if you have a loved one or somebody you know, that this information could be helpful to you. So I appreciate you stopping by and listening to the very first episode of Medical Mysteries, Mayhem and Makeup. I hope you guys enjoy the rest of your day or evening or whenever you're watching this. If you have any comments, just leave them below. Let me know. Do you have a loved one in this type of situation? Have you encountered this, you know, along the way? Is there anything you'd like to, you know, discuss? I'd love to hear your stories, and maybe, you know, we could find a way to get you the help that you need if you do have a loved one that needs, you know, bed rails or better care wherever they are. We can discuss some things. So go ahead and leave me some comments below. And again, I hope you guys are all happy, healthy, and well, and you enjoy the rest of your day or evening or whenever you're watching this. Bye.